Um, my name is Anthony Medley, Pastor Medley. I'm the new Health Ministries Director for the Allegheny Conference. I stand on the shoulders of Leah Scott and Gwen Foster. Both of them I know. I work with Leah Scott also. And please keep her in your prayers. Her and her family, let's keep her lifted up in prayer, and that God will sustain her and hold her together. If you want to know the things that I have planned for Allegheny East Conference, you got to go to the website. In fact, there's so much information on the Allegheny East website. Please go there and click under Health Ministries. When you go to Ministries, click under Health Ministries, and you'll see a number of initiatives that are there. But let me also tell you for all of your information from Allegheny East Conference, it is now being received online. So if you don't know, which means there is something you have to do. You have to go online. All the information is there. We're in that kind of world now. So no one is mailing you bulletins and booklets and so forth. It is online. And for health ministries, I also want to encourage you that if you're a health ministries leader, that if you would go to the North American Division Health Ministries website, that's where all health ministries directors are being asked to direct our leaders and others to that website, because it has a plethora of information that can benefit your local health ministries departments in your churches. So take advantage of that resource. I work with Angeli Brower on that from the NAD. I'm on her team, and so I know the information is there. We don't have our steps for our territory. We don't have from the conference to the union to get information. We go straight from the conference to the North American Division to get our information. So take advantage of that. It's incredible resources there that can help all of you. When people call me, when they're looking for things, I always send them there, and they're surprised. Oh, I didn't know this, all this was here for them. So please make a note of that, and God will bless you because of it. It isn't that I'm not available, but resources are in abundance. One thing our church does not have a shortage of is resources. What we have a shortage of is taking the resources and putting them to work and making them applicable for our context and those kind of things. So we're doing a lot about that also. When you go to the Allegheny East website, I need you to pay attention to the presentation on deliverance rooted in wellness, because the entire motif of how we will address health ministries in the Allegheny East Conference that serves underserved communities is out of the motif of deliverance. And that's an acronym that each one of the letters is potent with programs and opportunities. It will first become an online curriculum. Of course, if you're in the exercise program in the morning, you're already being tested. Rhoda, she has a test every morning to see who knows each one of the letters for deliverance. So remember that. You heard of New Start. You heard of creation. Well, deliverance is taking it to a whole nother level. It includes the principles that are in New Start, but it also has a social activism component in there, because Ellen White says that health reform and the three angels message is the true interpretation of the end time message. In other words, if our health message is not transforming communities, then we simply just have a health club for us as opposed to transforming others. And we've been called to do that, have we not? And so deliverance ties in those components, helps us to be more engaged, not only for ourselves, but also for others. And as Christians, we've never been called to keep it to ourselves. So today I am excited. I think we got a presentation. We're functioning with one side presentation this morning. So if you are in this boat, you're going to have to lean to the right to see this presentation, because we don't have it up on here at this point. Is that okay? Just want you to know we are aware of that. I've already expressed my concern, which means I have to move my seat. But I don't want us all to move too quickly, because I don't want the boat to tip over. So So I just want you to know if you're on this side, you're good. Yes, sir. I will get to that. I will get to that. That is before we leave, and make sure I talk about that. Okay, so I'm staying specifically on health ministries issues right now. Okay, I'm being intentionally selfish for health ministries, but make sure we announce that before we leave today. Also, want to remind you, as part of our day, the anointing service will take place at 6 p.m. That will be under the pavilion this year, and Elder Alston is leading out in that. We wanted to align that with the day of healing. I'm an advocate that believes that whenever if I go to a church and do a health ministries day, if you don't spend time in praying for the sick and for healing, you're not doing a complete health ministries. We're so focused on events, we forget the power of God, the healing power of God. So that's also a part of it. That's why it's also tied to today. And on tomorrow at 10:15, tomorrow, because of the banquet this afternoon, we did not have a morning and afternoon session. So the session that would have taken place this afternoon is taking place tomorrow at 10:15 here. And we're focusing really on balancing fall preventions. Hello. So I want you to come for that. You will probably be participating. Dr. Nikki Carrington will be here leading out in that presentation for us tomorrow. Make sure folk come, because that is another important component to our holistic health, about making sure, in martial arts, I teach falling skills, but I need somebody to come to teach us how not to fall. Isn't that a better thing to do? So we want to make sure that we have that on tomorrow. Before I pray, I want to pause to acknowledge and recognize, not to introduce, but to present to you our presenters for today. Dr. Ted Watkins needs no introduction. If you've been around Allegheny East, he is a person who has been here. The Lord has blessed him over the years with his passion, his expertise, especially in reversing diabetes. Amen. I'm taking my time on him here, because this is a topic that impacts our communities more than anyone else. And I have a personal testimony that I'm not going to take time to share in detail, but if there's one health issue that matters to me, is the disease of diabetes and reversing diabetes. I am a diabetic, and I have diabetes myself. Doc knows that. And I believe and know what God can do if you follow principles, healthy lifestyles to reverse things on there. It's a whole issue on there. So it's a soapbox that I stand on, because diabetes, as you would already know, also address so many other comorbidities that are affiliated with diabetes. So all those impact our community. That's why I want to make sure we have the experts here. Wherever I go, you're going to hear about diabetes. You can talk about all the other big issues, and they are legitimate, but diabetes is a cornerstone for us. And if there's nothing else in all of our churches, I think the problems we have is that we try to do everything and end up doing nothing. If your church and your community, if it's known, if you want to address diabetes, especially type 2, and all the other comorbidities in your communities, wouldn't it be great if the community says, if you go to that Seventh Adventist church, they have the best holistic program for type 2 diabetes. None of us are known for that, because we're so busy trying to do everything that we end up doing nothing. Hello. But I'm going to get off that soapbox. Doc, I can stay on there. What I love about Doc Watkins, not only is he an expert in his field, he and Dr. Cheatham partnered together for my 14 years when I was privileged to pastor the Emmanuel Brinklow Church. I have been a living witness to this man's work. It's not rhetoric, talk. But what I most appreciate about Dr. Watkins is that I've discovered that he has far more success with his programs outside the church than in the church. That other faith communities around the DMV flock to him. Are you hearing me? I have participated. I've gone to, he's asked me to present at a program that may have had 300 to 500 people there, and maybe 10 of them were Seventh-day Adventists. But people in the community flock to him. Now that matters to me. It matters that when your program is bigger than this, just trying to deal with folk who really don't want to hear it. Because even if they don't want to hear it, doesn't mean that the world doesn't want to hear it. And it doesn't discourage you from going and doing. You understand. He doesn't, well, that's a whole other issue there. But most recently, what I love about Dr. Watkins and Dr. Cheatham is that there is an initiative in West Baltimore. Hello. At a community center, not in the church, at a community center in West Baltimore. I mean, we got to park in the alleys to get there, deep in the hood. There's a community center there that he and Dr. Cheatham wanted to bring this diabetes program to them, but the community wasn't ready for it. They didn't know them. So here's what happened. Man, this is so dynamic, the reason I'm bringing it to you. So what happened, Dr. Cheatham, who was from the area, he started, mind you, retired, military, doc, endocrinologists, have served the world, around the world, well-respected, distinguished careers, both of them, a surgeon and endocrinologist. Here they are in the hood. But in order to build relationships, they started tutoring children for about 2 years. No health issues, helping them with homework, after-school programs. Are you hearing me? In the hood, not in the church. Building rapport in the neighborhood through the children. Circumstances happen where one of the community leaders, his good friend, died of type 2 diabetes complication. And remember, wait a minute, we got 2 physicians in our communities who are here tutoring our children. But they're experts in reversing diabetes. The community came to them because they built relationships in the community and asked them to bring their program now because the community was finally ready. There's so much to that. It wasn't about baptizing folk. It was about building relationships and then allowing the gifts that God has for you to get. So this man serves not only the church, but this man serves the community, he and his partner. And his presentation of reversing diabetes is worth hearing. He's a clinician that I depend upon. I have questions. I am not a clinical practitioner at all, but I know how to get them. That's my role. And Doc Watkins was one of those. When I was asked to be Health Ministries Director for the Allegheny Conference, he was one of those that said, if I need to speak why they need you in a position, just let me know. Because pastors are not normally in this position unless it's something God wants done. So I am delighted. Thank you, Doc, for being with us today. I know you have a lot to present. I think I'm done talking. You know I could talk about this topic. Dr. Cheatham is first, so we need to get him up online so I can talk a little more while we get him up. So Dr. Cheatham is not with us today. He's going to present to you online.
Well, I am excited to be with you today and to have the opportunity to present this program on diabetes. As you have been told, diabetes is something I'm very interested in, and we'll talk a lot about that as we go. But I'm especially excited to be partnering with Dr. Wendell Cheatham. Now, Dr. Cheatham and I met um, actually in 1971. 1971, when I went to work at the National Institute for Health. Dr. Cheatham was already there, all right? And Dr. Cheatham, and I don't remember even how long it was. I try to remember how long we were there together, but he went to medical school uh, shortly after I came. I went the next year. After medical school, Dr. Cheatham did a residency in internal medicine and then a fellowship in endocrinology. Dr. Cheatham has served as the vice chair of endocrinology at the Walter Reed Hospital. He served as chairman of Department of Endocrinology at Howard University. Dr. Cheatham has been the lead, the medical director of one of the largest, or if not the largest, producer of insulin in the world. He's conducted diabetes programs all over the world, all right? When he retired, and he always likes to tell folk, I am retired. When he retired as head of research, medical research for the Navy. So, you know, we're in high cotton here, all right? And what we want to do today is we want to present to you diabetes. Dr. Cheatham is going to start by giving some of the science, some of the pathophysiology to help you understand the disease. One of the things, we do a class together, and one of the things that he told our class is that high sugar, elevated sugar, is only 40% of diabetes, all right? And so you need to know it's much more than that. And he's going to help give us perspective, and then I'm going to come back and I'm going to talk a little bit about how to reverse diabetes, how to prevent and how to reverse. And so I'm going to get out the way and let the man, Dr. Wendell Cheatham, Wayman Wendell Cheatham, speak. Dr. Cheatham.
I had an opportunity to really become involved in the understanding of the physiology of how the body handles energy. Now, God created our bodies with the basis of our ability to move, to work, to live, and to accomplish our work for Him by using energy as our fuel, as the source of how our muscles and our limbs and other parts of our body live, how our brain works. And the basic compound that gives us that energy is glucose or sugar. But don't be misled. You don't have to eat sugar. You don't have to take in sugar for your body to use sugar, because the good Lord developed a means by which other nutrients that we take in can be converted into sugar. And there's a robust mechanism in the body to allow us to use the sugar that is being produced from other foods to be used for energy. Now, through the years, people have become attracted to eating sweets and taking in sugar. But one important thing that is often missed is that the sugar that we use in our brains, in our muscles, in our limbs can all be provided by food sources that are not necessarily sugar to begin with. People who have diabetes recognize that high blood sugar is a problem in diabetes. And because sugar is so easy to measure, the physicians and scientists, all the way from back in 1921, over 100 years ago, started focusing on measuring sugar as an indicator as to whether or not a person was healthy or not healthy as it regards to their that can occur in diabetes occurs in other areas, areas that you nor your doctor actually usually measure or monitor. But we found out through the years and through the work that the organizations that I've been associated with have shown is that the other compounds in the body that are produced when you can't use sugar normally, when you have diabetes, these other compounds that build up in the body give rise to many of the complications and problems of diabetes that people aren't even monitoring. Now, if you were alive over 40 years ago and attending Seventh-day Adventist conferences and camp meetings, you would often hear Elder E.E. Cleveland, who was at that time the associate director of the ministerial department of the General Conference. You would hear him give lectures, and as part of his lecture, he would show a slideshow. And that slideshow would often be of places he had visited around the world, especially in Africa. And I can remember very poignantly Elder Cleveland saying, "This is the Africa that nobody knows, because this is the Africa that nobody shows." And what he was referring to was a depiction, photographs of all of the modern buildings and extraordinary means of conveyance present in Africa, while back at that time, many people thought Africa was just jungle and huts and animals running around. Well, what we're going to do today is to show you what energy metabolism and what your body's health mechanism really is all about. But we're going to give it to you in a means that nobody has shown you before. Nobody shows this. People talk about sugar when they talk about diabetes, and they really miss the point of what diabetes really is doing to people and why people think they're getting their blood sugars improved and things are getting better, and they still suffer heart attacks, stroke, sudden death, loss of limbs, loss of kidneys, loss of vision, because they're too dedicated to looking at the sugar and not looking at the other components of metabolism. So Dr. Watkins, if you could put that first slide up, if it is available, the slide that depicts the way in which metabolism is handled in the body by means of the liver, the pancreas, the fat cells, the muscle cells in metabolism and in diabetes. So what you see in the upper left-hand corner of that slide is a triangular round object, which is the liver. Now, those of you who are thinking about diabetes think about insulin, and you've heard about the pancreas, which is where insulin is made normally in the body. God designed our bodies to use insulin in order to control blood sugar. But what many people don't realize, and many physicians even don't understand clearly, is that insulin, when it comes out of the pancreas is that little tan sort of looks like
That's good.
maybe a duck head with no eyes. That pancreas produces insulin. That insulin goes by means of the bloodstream into the liver first before it goes to the rest of the body. And it does multiple things in the liver to control metabolism. One of the things it does is to tell the liver to stop making more sugar. Because remember, I told you, we don't have to eat sugar in order for sugar to be used by our bodies. Our body will convert other substances into sugar. And the liver is the organ that is designed to do that. It will take the amino acids from proteins, it will take the fatty acids from fat, and then it will also take the constituents of carbohydrates that have been eaten in other form and use those to create sugar and allow sugar to go out into the rest of the body. That's the reason why people with diabetes often find that they will wake up in the morning with a blood sugar much higher than it was when they went to bed the night before, and they can't figure out why because they haven't eaten anything. Well, the reason why is because the liver has been making sugar overnight. The liver can make more sugar than most of us can take in our most indiscreet moments of eating inappropriate foods. And so the pancreas releases insulin to go to the liver, and the insulin gives the liver a signal to stop making sugar. And then the other part of the insulin, 50% is used in the liver to tell it to stop. The other 50% goes out into the rest of the body. That insulin is used to take the sugar that is already in the bloodstream into the muscles, into the fat, and into other cells and tissues to be used as a source of energy. And diabetes is a disorder that occurs when the body is unable to adequately respond to insulin. The liver doesn't respond appropriately, and the muscles and fats don't respond appropriately, and so the blood sugar goes up because it's not being used, and the liver hasn't stopped producing it. And a lot of medications that have been designed and produced and sold over these past 100 years have been attempts to focus on lowering blood sugar without recognizing that the sugar that we've been talking about is only 40% of the picture. The rest of the picture comes from circulating fats, circulating inflammatory compounds, circulating blood clotting compounds that are produced in the liver when it is not adequately responding to insulin. And so that's the reason why your blood sugar might look like it's normal and you still wind up with heart attacks, strokes, blockages in blood vessels that go to your limbs, loss of limbs because they haven't gotten sufficient circulation, and loss of nerve function, loss of kidneys, and loss of eyes. So the reason why Dr. Watkins and I are here today is to fill you in on the rest of the story that nobody knows, because it's the part of the story that nobody shows. And many, many primary care physicians have never been taught this part of the story. They also are focusing only on trying to get the blood sugar level down and not recognizing that the other components of this resistance to the effect of insulin, insulin resistance, metabolic dysfunction, is causing the complications of diabetes that they're completely missing. And some of those markers that could be measured, could be monitored, are these. Usually about 10 years before a person realizes their blood sugar is beginning to go up, their body is developing resistance to insulin. And even before the blood sugar starts to go up, this resistance to insulin leads to high blood pressure, it leads to high cholesterol, it leads to problems in the blood vessel walls that are called plaques. It leads to increased clotting so that you have blockages because these clots are formed and prevent the blood from going to your limbs and tissues. All of these things are happening behind the scenes 10 years before the sugar starts to go up. And these things are what lead to the chronic complications of diabetes. So one of the things we want to tell you about today is how you can change your lifestyle so that you not only are keeping your blood sugar level normal, but you are also changing the way that you live, changing your lifestyle so that you can prevent these other 60% of the problem of diabetes that people don't even measure and don't pay any attention to. You can prevent those from causing complications and disability. Now, one of the things that's very important, if we can go to that next slide, that is in the series of slide depictions. If you look at the stages of liver disease, you will recognize that there are 4 different pictures of livers there. Up at the top, there's a healthy liver. Then there's a fatty liver. Then there's a liver that is developing scar tissue called liver fibrosis. And then there's a liver that has cirrhosis. And we often think that the cirrhosis of the liver is something that just comes from drinking alcohol. And that's not true. You can develop scarring and problems in the liver simply because the metabolism of handling glucose and energy sources is atypical, such that your liver becomes fatty. If your liver becomes fatty, inflammation takes place. Inflammation leads to changes in the cell structure of the liver, and that will lead to scarring. So there are stages of liver damage that start off with so-called fatty liver. And if we go to the next slide, you'll see a robust, red, healthy liver on the left, and then a fatty liver on the right. That fatty liver, with all of that fat and all of those globules of yellow, is a liver that is occurring in an individual who is not properly caring for their metabolism through lifestyle and appropriate diet. And the way that we can determine whether or not a person is developing a fatty liver is very easy. We don't have to open a person up to look inside to see if we see fat in their liver. Over the years, we've collected enough information to know that we can determine whether a person is developing a fatty liver just by measuring their waist size, measuring the number of inches it takes to put a tape measure around their waist. Because if you measure the waist size, if you measure the distance around the waist, you can determine whether or not a person has accumulated lots of fat inside of their abdominal cavity, fat that is wrapped around the intestines, and fat also that is inside the liver. So when a person becomes overweight, it's not just being overweight and, oh, look, they have fat on their arms, and they have fat on their thighs, and they have fat on their legs. That overweight condition with enlargement of the abdomen points to there being accumulated fat inside of the abdomen, and not only wrapped around the intestines and fatty tissue that's all throughout that abdominal cavity, but it points to fat inside of the liver. Fat inside of the liver creates resistance to the effects of insulin. If you develop fatty liver, your liver cannot respond to the insulin that's coming from the pancreas to tell the liver to stop making sugar. And the liver will keep making sugar even if your blood sugar is sky high. And the only way to get that liver to get rid of that fat and to start responding normally to the insulin that the body would normally make is to reduce the fat accumulation in the abdomen and in the liver. So for decades now, people have recognized that the American population has become obese. I was in an airport just yesterday watching people walk back and forth up and down their passageways, getting to their planes. And I estimated that between 70 and 80% of the people who were passing by as I watched were overweight. Now, that didn't used to be. It used to be 50 years ago, if you were in an airport looking at people going back and forth to their planes, not as many people would be overweight. But America has become overweight, and we have become overweight. But we think overweight is just a condition. Well, yeah, I have too much fat, and I'm going to have to work on it, and it's going to get better. And we don't recognize that behind the scenes, that fat accumulation is leading to all sorts of metabolic dysfunction within the body that leads not only ultimately 10 years after it started to diabetes. And remember I said blood sugar doesn't start to go up till about 10 years after all this starts. So even before the doctor tells you you have diabetes, there have been all sorts of things going on in your body that have led to increased cholesterol, increased blood pressure, increased triglycerides, blockages in your blood vessels, and increased clotting and inflammation. You know, just as an aside, even people who develop arthritis, you know, there's rheumatoid arthritis and then there's so-called degenerative arthritis. And lots of people have problems in their knees and their ankles and their hips from arthritis. And they say, well, you know, I'm a little overweight, but that shouldn't cause all of this. But the arthritis that's not rheumatoid arthritis, but still is occurring, is occurring due to inflammation. And some of these chemicals that the liver is producing when it is resistant to insulin are inflammatory compounds that cause inflammation in the body that you don't even know, you don't even feel. But that is what gives rise to the osteoarthritis or degenerative arthritis or other changes that take place in your joints. Not even related to perhaps how much overweight you are, because some people who aren't very much overweight at all get these same problems. It's caused by the inflammation because of the resistance that the liver has developed to insulin. So if we go on now, we see a picture of a young lady in a red exercise suit. She's lifting weights, but you can look at that picture and you can see that she is about 40 to 50 pounds overweight. Now, you wouldn't say that that looks so bad, but that 40 to 50 pounds overweight is accumulated not only in her thighs and in her arms, but also inside of her abdomen. And she is developing a fatty liver. So if we go to the next slide, it talks about measuring your waist circumference. And if you measure your waist circumference, you put a tape measure around your waist at the level of your hip bones. Now, if you poke hard enough around the side of your abdomen and go down, you can feel the top of your hip bones. And if you put a tape measure around your waist at the level of where your hip bones rise, and look at how far the distance is for that tape measure, then you can get your waist circumference. People often buy slacks, and they buy slacks on the basis of the waist size, waist circumference. For example, a person who buys a pair of slacks that's size 36 has a waist circumference of 36 inches. Well, if we go to the final slide there, you have the criteria for waist circumference in adults. And the risk category is shown over on the extreme left-hand side. That risk category goes all the way from very low to high to very high. And that risk is the risk of all the complications of diabetes, as well as the risk of developing diabetes, so that we know that people are pre-diabetic or at risk for diabetes even before their blood sugar goes up, just by looking at their waist circumference. Why? Because we know whether or not they have fat in their liver. And if they have fat in their liver, they are developing insulin resistance, and their body is making insulin, but now we're going to look and just shake your heads. Because in women, to have a very low risk for developing diabetes and these complications of diabetes, the waist circumference has to be less than 27.5 inches. Yeah, that's a bird waist. That's a bird waist. For men, less than 31.5 inches to have a very, very low risk where we don't worry about you having any of these side effects and complications that might lead to diabetes or that might lead to the complications that we see in diabetes. To have a low risk in women, the value needs to be less than 35 inches. And to have a low risk in men, it needs to be less than 39 inches. If a man has a waist circumference of less than 39 inches, we say they have a low risk for developing diabetes and developing complications of diabetes, high blood pressure, high cholesterol, blockages of the vessels, sudden death, heart attacks, and stroke. But look, the next category down is high. A high risk in women is a waist circumference between 35.5 inches and 43 inches. And some of the ladies in the audience I know will say, boy, I'll scratch my head and say, when was my waist size as small as 43 inches? But look over at the men. At the men, 39.5 to 47 inches. High risk for men. Some men haven't seen 47 in a long time. It's much greater than that. And very high risk is above 43.5 inches in women and 47 inches in men. Now, many of you are going to say, well, my waist size is much larger than that, but I don't have diabetes. Don't fool yourself. A lot of people who are just beginning to see their blood sugars start to rise over years have sudden death due to heart attacks. They have strokes due to blockages of blood vessels. They have changes in their kidneys that lead to kidney failure. They have changes in their eyes that lead to loss of vision. Now, Dr. Watkins has developed a program, and I told him years ago when he told me about his program, I said, Dr. Watkins, you are way ahead of your time. You understand something that most people don't understand, because diet and lifestyle change is the way we know that people can avoid not only diabetes, they can reverse diabetes, they can prevent diabetes, but they can avoid these complications that are associated, that we associate with diabetes, some of which occur even without the blood sugar going up. So the bottom line is, stop just paying attention to your blood sugar level and stop thinking that, oh, my blood sugar isn't so bad. so I'm okay. We now know that we can correlate your risk just with the size of your waist, and people are dropping over dead because they have these inflammatory problems, the blood clotting problems, the high blood pressure, and other abnormalities that are occurring even without their blood sugars being high. So Dr. Watkins, I've taken a lot of time, but I hope this has given the audience an opportunity to understand why things happen that don't make any sense to them because they thought their blood sugars were pretty good. Well, again, only 40% of diabetes is your blood sugar. So if your doctor is only measuring your blood sugar and not measuring your cholesterol and not measuring your blood pressure and not measuring your triglycerides and LDL and other markers, then your doctor is missing the point. Listen to what Dr. Watkins is going to tell you and follow his advice, and you'll be on the right track. So thank you very much, everyone. It's been a pleasure being with you this morning.
Diabetes is more than a notion. You know, we said, you know, my doctor said I'm not diabetic. You know, he mentioned heart disease. Diabetes is the 7th leading cause of death in this country. But I have said for a long time that diabetes has a long history of maiming or disabling its victims and then killing them. All right? It does so because diabetes is the #1 cause of blindness, adult blindness. Diabetes is the #1 cause of kidney failure. Diabetes is the #1 cause of amputation. Diabetes increases the risk of heart attacks by some 500%. And it's interesting because Dr. Medley talked about this program we're doing in Baltimore. Well, just before we did the program, I went and reviewed my data because I didn't want to give any bad information. Still, the literature says that 50% of people who have a heart attack, their first symptom is sudden death. 50% of people who have a heart attack, their first symptom is sudden death, meaning you wake up dead. All right? You know, we saw my boy Stanford, you know, I was talking about Elizabeth, I'm coming. Well, that ain't no Elizabeth, I'm coming. Elizabeth, I'm there. Diabetes also increases the risk of strokes by some 200%. And so diabetes is a terrible thing. And we're going to mention it a little later, but the reason is that insulin resistance. Diabetes is multifaceted. There's a genetic component, and there's an environmental component. You notice the word genetics is very small. That is not an error, all right? I did that on purpose because I wanted you to understand that it's not just, you know, my mama had diabetes or my mama didn't have diabetes. Yes, genetics can be a factor, but the major issue is environment. It's stress, and from my experience, stress is the #1 cause of death, not heart disease, stress. You know, we talk about heart disease, it's associated with stress, #1. We talk about cancer, associated with stress. I've only seen one patient, and unfortunately, I see a lot of cancer patients. I've seen one patient that had developed cancer that didn't have stress for at least 2 years prior to the onset of that cancer. So stress cancer, stress diabetes, stress ulcers, stress, migraine, stress, even arthritis. Stress is a major thing. When we talk about stress, we also talk about the immune system. We talk about the immune system, we talk about inflammation. All of it is together. It's more than a notion. Obesity. Obesity is extremely, Dr. Cheatham, mute yourself. We can hear you in the background. Obesity is another factor associated with diabetes. In fact, we tell our class that you cannot reverse diabetes unless you get down to your ideal body weight. Your ideal body weight, that 27 inch waist in the female. You got to get down there if you want to reverse diabetes. Lack of exercise, and you notice diet is number 4. We think that diet is the most important. Diet is important, and we talk about it. We're going to talk about it today. But that diet high in fat and refined carbohydrates, fat and refined carbohydrates. Now, this results in what we call errors in metabolism, and that's what Dr. Cheatham talked about. So I won't try to expand on that, but it results in errors in metabolism. And then when that occurs, your sugar goes up. You have excess sugar, and you have excess insulin. Now, that's very, very important because, I'm an old man, but when I was young, we were taught that diabetes was due to what? A lack of insulin. A lack of insulin. And because we didn't have insulin, the sugar went up because we need insulin to get the sugar into the cell, all right? We need insulin to get the sugar into the cell. It's like a lock. The insulin is the key, and it goes into the lock, and it turns, and it allows the sugar to go up. But when you have diabetes, there's what we call insulin resistance. Insulin resistance, that's what Dr. Cheatham says occurs 10 to 12 years before the sugar goes up. But the insulin resistance is there, meaning that the sugar is there, the insulin is there, but the cell cannot utilize the sugar because the door cannot be opened. It is only when your pancreas has worked so hard to try to produce more insulin, to try to get the body to be able to use the sugar, that the pancreas becomes exhausted, that we have a lack of insulin. Now, the life you save may just be your own. You see this young lady on the left? Well, that's the same young lady on the right, all right? And her husband, Brother Paul, moderates a prayer worship service that I spoke on for about 10 years, 6 o'clock in the morning, Wednesday Wellness. So for 10 years, he heard me talking about diabetes and heart disease and all this stuff. Well, one day his wife said, "Honey, could you take me to the doctor today?" "Sure, honey." He's a very devoted husband. So when they get there and the nurse comes to draw her blood, she says, "Can you draw my husband's blood too?" Well, he needs to be fasting. Well, I didn't feed him today. So she drew his blood, and his blood sugar was almost 400. And they gave him a prescription for insulin and metformin. Well, he called me up. Dr. Ted, can you get my sugar down without me taking these medicines? I said, well, sure I can, if you're willing to change. He said, well, Doc, I'll do whatever you say. And he changed. Well, the life you saved is his wife, because she went on the program with him. And we don't have a picture of him, but I took this off of Facebook. They put it on. Look at her on the right, on the left. You know? She lost 46 pounds. He lost close to 100 pounds. I went up and did a session at his church up in Connecticut. And it was amazing. He brought an old suit. I mean, it was like he had lost half of his body. But it's been now close to 10 years. He's never been on blood sugar medication. And before, when you would go on Facebook, you would see him talking about deep fried turkeys around Thanksgiving and Christmas. Now, if you see him, he's talking about cauliflower. All right? Because Brother Paul, like myself, loves to eat. All right? And he loves for his food to taste good. And so he used his culinary skills to develop tasty, healthy foods. And that's what we need to focus on. In order to reverse the disease, and we're here, we want to talk about prevention, but, you know, when I left surgery, I tried to think, what do I want to call my practice? Well, preventive medicine, yes, but most people, or many people, are already sick. And so we have to also think about restorative. And so we want to restore, to reverse. I'm working on a book, you know, treating symptoms versus curing disease, all right? Most of medicine focuses on symptoms. You start off with one blood pressure medicine. Your blood pressure, you're taking it faithfully. And then you're on 2, you're on 3, you're on 4 medicines, and it keeps going up. One of my patients, well, actually, he was more of a friend than a patient, would call me up, Doc, my blood pressure is 120/70. I said, fantastic. How many medicines are you taking? He was taking 4 medications. I said, call me when your blood pressure is 120/70 and you're off the medication, all right? Well, that never happened. In fact, I preached his funeral because he would not listen. I begged him. I said, look, I will walk with you, because he was such a good guy. I'll walk with you, you know, just change. He wouldn't change. In order to reverse a disease or disorder, we first must understand the why. All right? That's what Dr. Cheatham was talking about. I'm going to talk about it a little more. The pathophysiology. And one of the things that we need to understand, that insulin resistance comes from eating that animal fat and protein. That's the number one cause of insulin resistance. And that insulin resistance leads to diabetes as well as other things. So to reverse it, once we understand the why, then we got to do something about it, all right? We got to do it. It's not enough to understand what is going to get me well. You got to do what's going to get you well. And you see, the diet is important. Weight loss is important. And this guy is out jogging. And you know, a lot of times people see this slide and they start laughing. Well, I don't laugh, because if you could see his feet are off the ground, which means he's not walking, he's actually jogging, all right? And if he continues to do that, it's going to increase the number of insulin receptors, the number of keyholes, a number of opportunities for the insulin to be able to work, all right, just by losing that weight. And then you got to exercise, All right? You got to exercise. And I have here 5 days a week, 60 minutes. But actually, what I tell my patients, for the first 90 days, I want you to exercise 90 minutes a day. 90 minutes a day. I remember this attorney came to me, and I told her that she needed to exercise for 90 minutes a day. And she said, Dr. Watkins, I can't. And I put my hand in her face. I said, look in the mirror. And keep looking in the mirror until you see somebody worth changing for. All right? The Bible, Christ said, was asked the question, what is the greatest commandment? He said, love the Lord thy God with all thy heart, thy soul, thy mind, thy strength. That's all he was asked. But he volunteered. But the second one is just like the first. Love your neighbor, got that, as you love yourself. Now that's a commandment. And I don't know, I learned somewhere back there that if you break the commandment, we call that sin. So when you're not taking care of yourself, that's sin. All right? You know, there's a book called Counsels on Diets and Health. Many of you have heard about it. I heard about it from a little boy, but I refused to read it because this guy in our church used to take Ellen White and beat us over the head with it. And so I didn't want to hear it. But one day I was impressed to go and read the book. And one of the things, I believe even in the introduction, she talks about that Christ looks at the physical law just as he looks at the moral law. He looks at the physical law just as he looks at the moral law. So we're worried about committing adultery. He's also worried about you being obese. All right? I didn't put the slide in here. 59%, and I've also checked this recently, 59% of black Americans are obese. Not overweight, are obese. And close to 40% of black men are obese. It used to be down near 20-something for men. But the brothers got tired of the women getting fat. They wanted some of that. And so they're getting fat now. All right? And so, but those things are killers. And then we come to nutrition. And this is very interesting. You know, people say, well, you can't eat sugar. And I tell them to shut up. You don't know what you're talking about. You can't eat refined sugar. You can't eat processed sugar. God gave us fruits before he gave us vegetables to eat. You know that, right? You know, if you read Genesis 1:30, the green herbs were for the animals. It was only after sin that we were instructed to eat vegetables. Before fruits, nuts, grains, seeds, that's what we were to eat. All right? Those fruits contain fructose. And Dr. Cheatham taught me here at Pine Forge, he was lecturing 20 years ago, that fruit contains fructose, and the body handles fructose different than it handles glucose. All right? And so, in addition, the fruit contains fiber, which slows the absorption of the sugar. Why is that important? Because if the sugar is absorbed quickly into the bloodstream, the insulin goes up in proportion to the sugar going up. All right? The half-life, or the time it takes to get half of the insulin out of the bloodstream, is 8 hours. The half-life of glucose is 30 minutes. And so you eat that refined sugar, the insulin goes up, the sugar goes up, the insulin goes up, the sugar comes down, but the insulin is still up there. And so you get this Jones. Suddenly you want a soda, or you want some candy, because your body sugar has dropped too low. And hypoglycemia is worse than hyperglycemia. And so the body doesn't like to have the sugar low. So you go and eat something else, and it shoots it up again. And that's how we wear the pancreas out, because we keep eating stuff to cause the insulin to go up. And the pancreas keep trying to produce the insulin, all right? So, but if you eat the fruit with the fiber, the sugar is absorbed slowly, and therefore the insulin goes up slowly. Then those vegetables, they contain all those antioxidants. You know, antioxidants, oh, that's such a nice big word. God made antioxidants, all right? You know, those vitamins, those minerals, those are the antioxidants. And the vegetables also contain the fiber, which also slows the absorption. And I love to talk about beans. I tell people I used to eat beans because I was poor. Not poor, poor. I now eat them because I'm smart, all right? Beans has so many good qualities. One of them is some beans actually stimulate insulin production. Beans have fiber, and in your body, and I was talking to Dr. Rhonda this morning about her work on her PhD dealing with this gut bacteria. In the small intestines, we have what we call prebiotics. These prebiotics come from the fiber that we eat in our diet. When they go down to the colon, they become probiotics. And people always going out buying probiotics. I tell them, you don't need to buy probiotics. You need to eat foods with fiber, because the fiber takes the good bacteria down to the colon and produces the probiotics, all right? And there's so much power in that. Here it's talking about how it slows gastric emptying, which blunts the rise in blood sugar. It helps to slow down the development of insulin resistance, which, as we said, is the defining trait of diabetes. Beans are one of the few foods, beans and grains, are one of the few foods that actually decreases waist size. You hear me? It actually decreases waist size. I have a friend just retired from Howard Department of Exercise Physiology. I tell people he's one of the smartest country boys I know. And so when I was interested in learning how, my patient would ask me, what exercise can I do to lose my waist, my stomach? I called him up. I said, look, what exercise can they do? He said, none. None. As you lose weight throughout the body, your stomach will go down. Beans and grains will take your stomach down. So if you eat them preferentially, all right? Then you got to stay away from a few things. You got to stay away from those refined carbohydrates, that white bread. You know, white bread is good to balled up and throw at each other. But it's not good to eat, you know. And I just won't eat it. You know, I'm sorry, I can't eat that stuff, you know. And you got to stay away from fat, from especially animal fat, from that cheese. I remember when I learned that 60 to 90% of all the calories in cheese came from fat. I said, oh, Lord, not Melito's pizza. See, I was a vegetarian. I was a ovo-lacto vegetarian, you know, because I love my cheese. But that was in 1992. All right? I'm still here. Matter of fact, I'll be 80 the 12th of this month, you know? And I'm still here without cheese. I go to all these Adventist functions, and I don't see the meat, but I see the cheese. And I tell folk, if you really study from a physiologic perspective, cheese is worse than meat. And meat is bad. One of the things that I do with my diabetics, and Dr. Cheatham told me I need to tell you what I do, is I put my patients on a fast. I put them on what I call a modified juice fast. All right? A modified juice fast. And I saw Dr. Cheatham at a meeting one time. I said, Doc, we were both early in our practices. I said, Doc, most people say that diabetics shouldn't fast, but I get excellent results with my diabetics. He says, Ted, you're just ahead of your time. Keep doing what you're doing, all right? Just make sure that after day 2 or 3, you start cutting their medicines down. So generally, between day 3 and 5, I have my patients off their medication. Now, this plant-based diet has been compared to the diet of the American Diabetic Association, all right? The plant-based diet, research has been done. This is not just Bible, although that should be sufficient. This is not just Ellen White, although that should be sufficient. But there's a lot of science out there. And the study showed that the plant-based diet improved glucose control. There was a longer-term insulin sensitivity, or being able to get the insulin into the cell. There was greater weight loss. There was lower risk of cardiovascular disease. And this is what I like, it was better tolerated. They actually once they got on the plant-based diet, they liked it better. I have a good friend, Dr. Metley, talked about me and my Baptist. I have so many Baptist preacher friends, I can walk into maybe 15 churches in D.C. and go straight up to the pulpit. I won't do that in the Adventist churches, but I can do that in the Baptist churches because they love me. But one of my brothers called me. He said, Doc, I never thought that I could be off chicken and not miss it. But he's plant-based, all right? Why? Because he likes being well. Diabetes causes a lot of problems. One of them is blindness. This slide shows the eyes of a person that had diabetic retinopathy. You notice on the right, many of those changes are gone. The fatty infiltrates, the bleeding into the eyes, all this stuff is gone. The broken blood vessels, gone. There was a guy, he's dead now, Dr. Kempner at Duke University came up with something called the rice diet. The rice diet. He started it for malignant hypertension and kidney failure. He thought that it would actually make diabetes worse, but he found that it actually would reverse diabetes. It reverses obesity. It reverses all kinds of things, including cardiovascular disease, rheumatoid arthritis, and so forth. I tell people it is the most powerful nutritional program I've ever seen. I've been on the radio over 20 years. I've seen just about every diet plan out there. The rice diet, rice grain diet is best. There's a guy, Dr. Neil Bernard. He's over at GW. He started the Physicians Committee for Responsible Medicine. He and some others did studies to show that even diabetic neuropathy could be reversed with a plant-based diet. See, I used to call these folk heathens, all right? They're heathens. Now I call them rocks because it hit me. The Bible says that if you don't do it, the rocks will cry out. And these folk are crying out and do it. So on our program, on our reversal program, We get control of your diabetes in 3 to 5 days, meaning your blood sugar is normal, and for me, normal is 85, all right? We get you off your medication, but you're still diabetic, all right? Because until we change those end organs that Dr. Cheatham talked about, the pancreas, the liver, the muscle, the fat, until we get those normal, you're still going to be diabetic. And then we reverse that over the next 3 months, the next 90 days. That's what we do. And I think that's it. Thank you once again for the opportunity to come and speak to you. I pray that this has been some benefit. Once again, thank you, Dr. Cheatham, for your